We looked in the study and actually found that all of the synthetic opioid overdose deaths, about 80% of the time, involved at least one other drug or alcohol. So certainly the combination of drugs is very common among people who die of an overdose. The way the mortality data are documented, essentially the medical examiner or the coroner makes a determination that the particular drugs that are listed were somehow involved in the overdose death. Not that they were just present, but they were actually involved. So in the vast majority of all drug overdose deaths, usually more than one drug is involved. From a clinical perspective, I would certainly say that clinicians will default to what are the presenting symptoms. So an opioid overdose, whether it's a prescription opioid or illicit fentanyl, will present similarly, where people will tend to have slowed or stopped breathing, they'll have pinpoint pupils, the classic symptoms of an opioid overdose, which look very different than, say, methamphetamine or cocaine, which tend to be more excitatory symptoms. So we would expect that clinicians should be certainly aware that patients may be reporting that they have used cocaine, but their symptoms may actually show that they're likely suffering an opioid overdose. And if that's the case, naloxone would be a drug that would be administered to reverse the respiratory and CNS depression.